My name is George Saravia. My presentation is going to be about the grid. Grids are used to reduce scatter radiation. So the person who invented the grid, his name is Gustav Buggy. So the first grid looked like this. It had the parallel lines, which are the lead strips, and grids use lead because it has a high atomic number, and they also had horizontal lines. This grid was also called is also called a crisscross grid, or a crosshatched grid. Now this grid, since it's eventually not going to move, the lines are going to intercept with the image. So when the image comes out, you're going to see how in the actual image the lines coming out like kind of like a zebra stripe. So the next grid is going to be a linear parallel grid. It's going to look like this. And the linear parallel grid, it's only going to have the parallel lines, the lead strips. Now this grid is actually going to be very problematic because the beam exits the X-ray tube kind of in an angled or slanted manner, and it's going to intercept with this grid. So in the image, you're also going to see the lead strips coming out, and it's not going to be a very good image. Now the image that's perfect for to take X-rays is called a focus grid. It's going to look like this. Okay, so in the middle of the focus grid, we're going to have the parallel lines, which are the lead strips, but from the middle out, they're all going to be slanted. Okay. Now this grid is actually going to be perfect to take the X-rays because since the beam exits the X-ray tube slanted in a slanted or angled manner, it's going to coincide perfectly with this grid, and you're going to have an overall a better image. Now the last two grids we're going to talk about, it's a reciprocating grid. A reciprocating grid, it's going to move back and forth when it is exposed. So anytime the grid is in exposure, it's going to move back and forth. Anytime is in exposure. And the last one is going to be called an oscillating grid. Now, an oscillating grid is actually a very effective grid because it's in a circular motion. When it is exposed, it's going to move in a circular motion, opposed to the reciprocating, which is only back and forth. Okay, so here we have the grid, and the grid label should always be facing upwards towards the X-ray tube, because if you flip it over, we're going to have the upside down error, which means that in the middle of the image, it's going to look okay because the X-ray beam is perpendicular, but on the sides, it's going to look white because due to lack of exposure. Okay, so this is the image that we got from the upside down grid error. So like I said before, in the middle, the image looks okay because of the X-ray tube being perpendicular, and the white here that you see is due to lack of exposure because of the slanted/angled manner that the beam comes out of the X-ray tube. Okay, so now we're going to be going over the Moore effect, also called the zebra effect. So what this basically is that we use a double grid for patients who have an increased body thickness. And this double grid error, when we go over the image, in the image you're going to see that there's like stripes that they look like zebra stripes because of the both grid that we have here that we're using. So here we have the grid underneath here, and with this one here we're gonna make the double grid, and sometimes it is hard to align them, but now we're gonna go over the image. Okay, so here we have the Moore effect. So with this effect, you can still see the image, but there's always the risk of having the lines, the zebra stripes, as I like to call it, because of the double grid that we use. Okay, so here we have the grid, and each grid has a specific distance, 34 through 44 inches. Now, once we place the grid here, we're gonna have to lower the SID to less than 34. and we're out of the range. And once we put the skull right here, you want to make sure that the grid is focused along the convergence line. Okay, so for the grid to be properly focused, the X-ray tube must be located along the convergence line. And here we have the off-focus image, which here you can see like a penumbra or a shadow, which means that there was a lack of exposure. Okay, so now we're going to be going over the off-level grid error. Off-level is very simple. It's basically when the angle of the X-ray tube is incorrect, is set up incorrectly, and what that could cause is elongation in the image and also lack of exposure. Okay, so here we have the grid, and as I mentioned earlier, the middle is parallel, the parallel lead strips, and towards the middle out, it starts to become slanted. So from the X-ray tube, the beam is going to come out and it's going to get trapped in the lead strips because the angulation is wrong. And this happens in the stationary grids, but not in mobile grids. And in the image right here of the skull, you can see how it's elongated because of the incorrect angle and the lack of exposure. Okay, so our next error is going to be an off-center error. So this happens a lot with the first of all, this is a cross table. This happens a lot with the trauma patients, like when there's problems in the lungs and all that. And it basically happens when the detent is not centered, and that's what creates an off-center error, or another name for off-center is lateral decentering. Okay, so here we have the off-center grid error, also called lateral decentering. So here we see that it gets dark and then it starts getting lighter, lighter, and lighter, and lighter. And the off-center grid error also produces grid cutoff, which means that a piece of the picture is missing. Okay, the next technique is the air gap technique. And the air gap technique is used when we don't have a grid or a grid isn't available. And we have some trauma patients, so we have to act quickly. So here we have the skull. And then as you move the skull towards the X-ray, towards the image receptor, you see how the image becomes bigger, so it doesn't allow for the scatter radiation to reach this part. So this image here it was with the air gap with grid, and the other one is the air gap technique with no grid. And as you can see, it looks very similar, but the air gap technique, the main role is to increase the OID to reduce the scatter radiation that reaches the image receptor. Okay, so in conclusion, it's important that we center the grid correctly, do everything correctly, including the angle, the SID, the OID, and everything. That way you don't have to repeat images, and the images can come out correctly the first time that the X-ray is taken.